There is so there are some medications which are recommended for treatment of fatty liver. Antioxidants like vitamin E and some artificial bile acids like ursodeoxycholic acid have been recommended for fatty liver. But honestly speaking, there is no medication which will reverse fatty liver or which will reverse NASH. But fatty liver or NASH is a reversible condition. When a patient has a fatty liver or a NASH, it can be completely reversed. But once the fatty liver or NASH over a period of 15 to 20 years time becomes cirrhosis, once you have cirrhosis, even if you treat the underlying cause, the cirrhosis does not get reversed. The same way as a patient with hepatitis B, hepatitis C or alcohol, in the early stages, if we treat the hepatitis B, C infection or stop drinking alcohol, the liver becomes normal. But once the liver becomes cirrhotic, even if you treat the hepatitis B, hepatitis C or stop alcohol consumption, it's a progressive, irreversible process. The main treatment of fatty liver is first is to get yourself checked by a doctor for fatty liver. Patients with NASH, patients with diabetes with fatty liver are at a very high risk of going for NASH and subsequent cirrhosis. So these patients should achieve, the only way to reverse the fatty liver, reverse the NASH is by achieving weight loss. Only when you, at least like you have to see, usually a simple formula is you look at your height in centimeters. If you are 170 centimeters, for example, minus 100 is your ideal body weight, roughly. So the more closer you are to your ideal body weight, if you lose around 10-12 kilos in patients who are around about 20 kilo overweight, if they lose 10 to 15 kilos of weight, the fatty liver and NASH reverses, and that's the only way. And patients with alcohol, if you're obese and already have fatty liver, they should absolutely abstain from alcohol totally, because alcohol not just contributes to the fatty liver and obesity, it will also increase the rate of liver damage and increase the risk of cirrhosis. So the main treatment of fatty liver is prevention by a healthy lifestyle, cutting down on your carbohydrate intake, cutting down on the junk food, processed food intake, avoiding alcohol, healthy lifestyle, an active lifestyle, increasing the protein in your diet, increasing the fiber in your diet. These kind of things are the main thing for prevention of fatty liver rather than treating fatty liver.